Hey folks, Dr. Gerstmar from Aspire Natural Health. Good morning, good afternoon, good evening. Whenever you happen to be watching or listening to this, I hope you're having a fantastic day. Well, today I wanted to talk about the concept of, are you healthy? Are you really healthy, or are you just not sick? Are you healthy, or are you just not sick? Now, regular medicine does a good job of helping us when we're really sick. But for them, there really are only two categories. You're either sick, and if you're not sick, then you're healthy. So healthy is really the absence of disease. You're either sick or you're healthy. Now, when we talk about a more holistic or well-rounded picture, we understand that there are more than just those two categories. There's more than just being sick or being healthy. There really are four categories. There's being sick, there's being not sick but not healthy, there's being healthy, and then there's thriving. So there's sick, there's not sick but not healthy, there's healthy, and then there's thriving. So there really are four categories that we're looking for. And the reality is that many of us are not sick. So when we're sick, we have a lot going on. We have big symptoms. We feel bad. Our tests are abnormal. They're showing that something is really wrong with us, and we need some sort of treatment, right? From the regular system, that can be medications, that can be going to the hospital, having surgeries or other procedures done to fix us. And it's usually really obvious to us and to other people when we're in that sick place. Again, the regular system does a good job of helping people when they're in that sick place. But for a lot of people, they get out of that sick category. They're told by the regular system, you're healthy now, and that's it. But we recognize that many people, many of us out in our society, are really in the second category, known as not sick, but not healthy. Now, this is a place where we still have some symptoms going on. We generally don't feel really good, but we're not in a sick place with big symptoms, big issues. When we get our tests done, we may be told by our regular doctors, it's not ideal. It's really not where it should be, but it's not that bad. It's okay. It's borderline. We may often be told the tests are, it's okay. But if someone more holistic or integrated takes a look at it, we can clearly see, now, this isn't that great. One example that's super common in our society is something called fatty liver. Fatty liver. This is when our liver is full of fat, it doesn't work as well. Often there's a lot of inflammation in the liver. This goes along with blood sugar problems, pre-diabetes and diabetes and obesity for people. And we often see people's lab work and they're told, it's fine, but we look at it and it's clear that this person has a fatty liver going on. Is this like really big, scary, dangerous, like they need to be in the hospital or something? No, of course not. But we can't call someone healthy when they have a fatty liver or pre-diabetes or high blood pressure or some of these other issues. They would be in the not sick but not healthy category. And the thing is that this category is considered normal by most people out there. When we talk about, all aging and all the bad stuff, the it's a hard word here, deterioration that happens. Look, we all age. Things happen. When we're 40, 50, 60, and beyond, we're not 18 anymore. And thinking that we're going to be is unrealistic. But it also doesn't mean that we're confined to the rocking chair, sitting on the porch, yelling to get at those kids to get off our lawns and everything. That's deterioration, not healthy aging. And a lot of that comes about because many of us spend a lot of time in the not sick but not healthy category. And again, regular medicine does a great job of getting us out of the sick category. But this is where functional, holistic, alternative, or natural medicine really shines, is helping people in the not sick but not healthy category move up to being healthy, and then ideally moving beyond that to thriving, where people really feel fantastic. They're full of energy, they feel great, and they're they're unencumbered, like they can chase their dreams and do the things that they want with their lives, their personal lives, their professional lives, and everything in between. So it's important that when we think about where are we right now? Now, most of us know when we're sick. That's not really a surprise, but it takes a bit of a honest eye here when we really evaluate ourselves. Are we really healthy? Do we really feel good the vast majority of the time? Look, no one feels great all of the time. Even if we're in that thriving category, doesn't mean we feel great all of the time. Life happens, things happen. But in general, really, are we feeling good the majority of the time? Are we having really any significant issues or other things going on? Are we really taking care of our health and doing all the foundational habits the majority of the time? What do our tests really look like? For many of us, if we're honest with ourselves, take a moment of quiet reflection, we realize we're really not healthy. We're not sick, but we're not healthy. And that is okay. The first step here is simply recognizing where we are. Now, what can we do? Obviously, all the fundamental things, eating well, getting enough sleep, exercising regularly, and managing our stress, those are the great 4 places for you to start. Think about, are you eating well most of the time? Are you getting enough sleep at night? Moving your body on a regular basis and managing your stress. If you're not, that's a great place to start. Pick one of those things and get to work on it, right? Then you can work on taking it farther from there. If you really do have issues going on, prediabetes, high blood pressure, all of these other issues, then certainly please seek out qualified health practitioners to help you through the process, because it's great that we're not sick, but we're also not healthy. We're not able to live up to and live the lives that we should and we deserve to be living. All right, folks. So that is the primary piece today. It's not as simple as you're sick or you're healthy. It's you can be sick, you can be not sick, but not healthy, where a huge chunk of our society is living right now. Staying in that place is a surefire way to age badly and to suffer from issues and unneeded complications. We ideally want to move from the not sick to not healthy to the third category, healthy, and then ideally to the fourth category where we're really thriving. Now, there's some simple things that we talked about that you can do. Make sure we're eating well, getting enough sleep, moving our bodies and managing our stress are great places to start. If you've got other issues going on, whether they're digestive, whether they're autoimmune, whether they're things like prediabetes, diabetes, or high blood pressure, any of these other issues, we want to make sure that we get that taken care of. Now, if you're happy with your care and your regular doctor, great. But if you're looking for something more, then I urge you to seek out a functional, holistic, alternative, or natural practitioner to help you in that process. We are ideally situated to help people go from not sick and not healthy to healthy and on up to thriving. All right, having said that, folks, if you're dealing with digestive issues or autoimmunity, that's where we really shine. We're really experts at helping people with digestive issues and autoimmunity to go from sick to healthy and then up to thriving. If that's you, you're sick and tired of being sick and tired, you're friendly, open-minded, and coachable, and you're willing to make an investment of time, yes, money, and yes, energy. It is going to take some time and effort to improve your health, especially if we want to do it in a sustainable way that you see the benefits for the long term. Then let's have a chat. Let's see if we are the right fit to work together. If we are, great. Talk about next steps, and we'll see what we need to do to help you transform your life. If we're not the right fit, that is okay. Listen, we are not the right fit to work for everybody, and again, that's okay. But if we are the right fit, we'll transform your life, and if we're not, we will still do everything we can to help you to feel better. All right, folks, that is it for me today. Listen, if you'd like to have a chat, then I urge you, just go to the website, aspirenaturalhealth.com. That's aspirenaturalhealth.com. Click on the button that says Ask About Price and Availability. That's going to tell you more about the way that we work, whether we have any availability or we're on a wait list, and the investment to work with us. If all of that sounds great, then you'll click on the second button that says Apply for Help. Apply for help. All right, folks, until next time, take care.